This is what I like to see. Hello, everyone. Welcome. We're going to give people about 1 minute to connect, and then I'll pass it right over to Blake, my supervisor, the Training and Outreach Unit Chief at OVS. But we are so happy to have you all here. All right, Blake, take it away.
All right, awesome. Well, good afternoon, everyone. Welcome to the 2023 OVS pre-conference webinar. This is the impact of mass violence incidents on first responders, qualitative data from 4 sites and following MVIs. So I'm Blake Cush. I'm the Training and Outreach Unit Chief at OVS. And today's training features CART and ASL services. Our ASL interpreters are spotlighted, so you should see them. And live closed captioning can be enabled from the bottom of your screen. Our director, Elizabeth Cronin, is also with us today, and she'll offer some opening remarks shortly. I'm just going to cover a little housekeeping first. So today's webinar is the second of our pre-conference webinar series, and these new training opportunities were requested from attendees of previous OVS conferences. And what's exciting is that you don't necessarily need to join us in person for the 2023 OVS conference in order to participate, but we do hope to see you in Albany in just a few weeks. And we hope you get the most out of this training opportunity. So should you want to go back or revisit what was covered, all of these webinars, including today's, are being recorded and will be published on the OVS YouTube channel. It takes about a day or so after each event for us to get it uploaded for you. You can access those links and other resources on the 2023 OVS conference website. Special shout out to Rachel. It's a beautiful and very informative website, which we'll put a link in the chat for you as well. And then finally, as soon as you exit today's webinar, you'll be directed to an evaluation survey on the presentation. You'll also get a follow-up email with the link for that evaluation survey as well. So please take a couple minutes, give us your feedback. We incorporate feedback in real time. So if there was something from last week's webinar that we thought could be useful in shaping today's, we do that. We make those changes in real time. So incredibly valuable. It also gives feedback directly to our presenter, who you're going to meet in just a minute as well. So it helps them continue to improve as needed. With that said, I'd like to formally welcome the Office of Victim Services Director, Elizabeth Cronin.
Thanks so much, Blake. Welcome, everybody. We're so thrilled to have you for this virtual pre-conference presentation. I want to, as always, thank Rachel and Blake and the Outreach Dream Team for doing such a continuously amazing job at putting on these programs. We're really grateful and thankful. And as you know, the full conference will be in 2 weeks in Albany, and we have one more free webinar that anybody can attend. You know, we're so lucky to have had such incredible submissions for the conference, and so we decided to extend the conference programming because of that. So I'm really thrilled to welcome Dr. Moreland, or Angie as some of us call her, to this program, because she is just a wonderful presenter and has such great experience and expertise in this area. And I got to know her because of my involvement with the National Mass Violence and Victimization Resource Center. Say that quickly 3 times. Yeah, I know. But I was invited to be part of a panel when they had just gotten the grant to set up this resource center, and they called a number of people from different states. And I was so grateful to be involved in that initiation of the center. And we've worked collaboratively from then on. So I think you're really going to get a lot out of this program. I just want to mention, you know, we don't often think, we talk a lot about victims and survivors of events such as mass violence or any kind of violent event, but a lot of times we forget about the secondary survivors of this, and one of those is first responders. And you know, we saw it in Buffalo when we responded to the mass casualty event in May of 22, when you had investigators, law enforcement, paramedics, DAs all responding to this horrifying scene And this is something that they do repeatedly. And I think we don't always remember that even though somebody's doing their job, that this can have a profound effect on them and their loved ones as well. So this is a conversation that we really need to continue to have and think about those who are affected well beyond the immediate victims that we often are most concerned about, you know, understandably. But I'm happy that we're able to present Dr. Moreland and her work in this area. So Angie, take it away.
All right. Thank you so much. And I feel very honored to be here. And I'm so glad that I was asked to come and talk to everyone today and to be able to share this this work that I'm really, really passionate about. So I'm going to talk as Elizabeth and Rachel and Blake talked about today. I'm going to talk about first responders more specifically today, but I will kind of introduce to our center and kind of what we do and speak a little bit more about the work that Elizabeth talked about, especially because I know a lot of people on this call are working kind of in that space. And even if you don't specifically work with first responders, some of the information on mass violence in general may be helpful and on our center and what we do. So just to give a little bit of background of kind of where I come from. So I'm at the National Crime Victims Research and Treatment Center. So again, sorry, Elizabeth, say that again. It's a center within the Medical University of South Carolina. And we have been doing work with victims of trauma for multiple years. So my background is much more kind of in more broad trauma and in working with people that have experienced violence. In 2017, we were funded through a cooperative agreement through the Office for Victims of Crime. And I'll talk a little bit about that and how that started. And that specific mission was to specifically work with mental health impact of mass violence events that are occurring. And then specific to today, first responders have a very close place in my heart. So I work very closely with a lot of first responder organizations, both with mass violence specifically, but then also outside of the mass violence space. So most closely with firefighters. I'm a contractor and a consultant for the National Fallen Firefighter Foundation and have worked with them on trauma and PTSD and just a lot of the bad things that happen in the context of their jobs. And much like what Elizabeth was saying, that really can start to impact. So this presentation today is actually very meaningful to me because it kind of merges both of those worlds. So it merges the mass violence world, which is very dear to my heart, and then also the first responder world as well. So I'm going to go ahead and pull up my slides. And I am completely fine with people putting questions in the chat kind of throughout. I can't promise how quickly I will be able to respond. I tend to kind of be able to multitask and do that. But if you do have questions that come up throughout, please go ahead and put them, because that, number one, if it is a good place to kind of stop and be able to answer it in the moment, I'm happy to do that. But it also just gives me an indication of kind of how much time to leave and whether to leave some time to be able to ask questions at the end, because I'm very open to questions. There's probably 5 days, if not more, that I could talk on this topic and be able to talk kind of in general about this. So as was said, I'm the associate director of the National Mass Violence Victimization Resource Center. That's the last time I'm going to say it. I'll say NMVVRC or just the Mass Violence Center kind of moving forward. But just to acknowledge, we are, like I said, a cooperative agreement through the Office for Victims of Crime. We've been working closely with them since 2017. And one of the main reasons that we very first started our center, or that our center got funded in 2017, was mainly to be able to kind of pull together resources and to kind of be a hub of those resources when it comes to mass violence. So there were increasing numbers of mass violence incidents, unfortunately, happening throughout our country. And the response was kind of variable, and it still is kind of variable, but it's gotten a lot better. And every time an event happened, it tended to be a little bit more chaotic. It's always chaotic, but tended to be very chaotic as far as where resources were coming from, who provides those resources, and kind of how to pull those together and get them into the hands of the organizations, of the community, and of the people that need them pretty quickly after the event. So our role as the Mass Violence Center is not necessarily to initially respond to all events, although sometimes we do tend to help in response, but it's more so to be kind of this overall hub of being able to provide information and connect resources and connect organizations. So just to mention first, I am going to be referring to mass violence incidents throughout this presentation. I know people are aware of that by the title, but I do want to just very much acknowledge that it can cause some trauma cues. So whether you have reactions to trauma cues, so whether you have been involved in a mass violence incident, you have watched television in the last 10 years and have seen footage from a mass violence incident, you can be triggered or can have trauma cues based and have reactions to these cues. So just want to make sure. I don't have anything super graphic in here, but I do have some images of the locations just to put them into context of kind of where we are and what we're talking about when we're talking about these first responders. So I'm going to talk a little bit more about our Mass Violence Center, what I already started talking about, then talk about the mental health impact of mass violence on communities, and then specifically on first responders today. And I love that Elizabeth opened up not this morning, but the session by saying that we don't always think about first responders. So they're the first ones on the scene. It is in the context of their job, but I think it's very important to step back and think about what the impact on them has been. Then I'm going to discuss some focus group findings that we had from some focus groups that we did with first responders, and then some strategies to decrease the impact of mass violence through several different phases. So through the planning phase, response phase, and resiliency phases, which I'll explain a little bit more of later. So the mission of our center is to improve community preparedness and the nation's capacity to serve victims and communities recovering from mass violence through research, training, planning, technology, and collaboration. So that's kind of where I talked about that hub of resources, that we have resources, and our job is to try to improve communities kind of through the planning, recovery, and resilience stages of mass violence if it were to occur in your community. This is our website. So the amount of information on this website would take you months to go through if you went through every single piece of it. So I'm going to put it here, and then I will put it up at the end as well. But I strongly encourage you, regardless of kind of your background or your organization or where you sit kind of within the space, to visit our website. There are a lot of tip sheets on the website. Our links to our town halls are there. There's podcasts that you can get to. There's just a wealth of resources that whether you have experienced a mass violence incident in your community and are looking for resources, or whether you're just kind of wanting to have things on hand for your community in case something were to happen, there's a lot of very helpful things on here. So just to kind of step back and give a little bit of context of this and talk about what is a mass violence incident. I think everyone in theory knows what a mass violence incident is. If I went around and had all currently 129 people on the call say what a mass violence incident is, it would be similar in definition as people went across and gave their definitions, but there would be some pretty significant differences as well. So I think it's very important to kind of define this and define what I'm talking about and how, in the context of what we're considering a mass violence incident in this talk today and in what we're talking about. So it is an intentional violent criminal act where a formal investigation has been opened by the FBI or other law enforcement agency, and it results in physical, emotional, or psychological injury to a sufficiently large number of people. And you can kind of read the rest of this. Just in reading this, you can see how vague this is and what a gray area this is. There's not a very defined, by this definition, very defined definition of what exactly a mass violence incident is. And that's what can make it very difficult. So there's a lot of terms for mass violence. So we hear people talk about mass violence, mass casualty, mass shootings is one of the largest ones, or one of the more common terms that we hear. Active shooter, especially when we're talking about preparedness or talking about schools. We talk about active shooter a lot. And the issue with this is there's a lot of sources of these terms and a lot of sources of the definitions. So when you look at the different definitions, rightfully so, different places have really tried to put parameters on what the definition is. Otherwise, how do we really know what we're talking about when we're talking about mass violence? But because of that, there are some differences in those, and that can make it very difficult both to study mass violence and kind of even to report very simple prevalence rates. Prevalence rates differ pretty significantly, whether we're including shootings or other types of mass violence, if we're including only the number of deceased. So for instance, the definition between like FBI and some of the other organizations, some organizations say 2 are deceased in the event and then may have a certain number injured. Some say 3. And even when we think of those different definitions, it very much can cause difficulty in kind of what we're talking about. And there's no legal definition. There's just multiple definitions based on the use of what's needed. And that could cause a lot of issues. So that because there's no universally accepted definition, it sometimes has to do with motivation. So it can have to do with if it was intentional versus, or not intentional, but whether the victims were known versus whether they were not. So in some definitions, it doesn't count, or most definitions, it doesn't count as mass violence if it is someone seeking out a particular person in order to harm them or kill them or injure them, even if others were kind of caught in that incident and were injured or killed during that incident. In other definitions, it doesn't. Type of weapon used, that death injury. So whether it's 2 people, 3 people, 5 people can make a difference. And this, from a research standpoint, is difficult, but even from a clinical standpoint. So they don't always count as MVIs. And that means, and what I mean is count is it doesn't matter specifically. If people are injured or if an incident occurs, people are going to experience trauma and there is going to be mental health impact. But where it does matter is whether they're qualifying for victim assistance, if they're qualifying for particular services, and in certain areas, kind of what services and resources are available to people. And the OVC definition is very important because it drives eligibility for AEAP grants. So some people may be familiar with those grants, and they're grants that are given to or applied for and provided to communities for types of assistance and services for mass violence survivors after an incident. So not that it's money driven, but it is assistance driven. So sometimes it is very important to think about that definition based on what's going to happen in a community. I know that a lot of people here on this call may have been present or may have been involved in the response to Buffalo. And you kind of can speak to this and say just what the difference is based on what services were provided and what grants and what assistance was able to. Our Emmanuel AME church, Mother Emmanuel, there was a church shooting here, as most people are familiar with, in 2015. And I can say not only from a program perspective and from a psychologist perspective, but just being a member of the community, how much those services and resources really do significantly impact the community and can be very helpful following an incident. So who are the victims of mass violence? We obviously think of this first bullet and most times think of the second bullet. So we think about those that were killed or injured. So the people that were at the scene, those are the very obvious victims, right? And then most people will consider, or second, maybe think of the family, the friends, the neighbors, the loved ones of those direct victims. So people who knew someone present during the scene or lived nearby or were very closely kind of related. But then you can see it doesn't stop at 2 bullets. So there's a lot of bullets here, and it very much impacts the entire community. And I'm sure I could probably double or triple these bullets as well. So these are the main ones that we kind of talk about in addition to the at the scene survivors, but it really does impact our community as a whole. And we've done a lot of work. I'm not going to present specifically on this work today, but within our center of doing needs assessments and of that impact on the entire community. And we found pretty significant impact, not only on people included in these first 2 or 3 bullets, as we're talking about today, but everyone kind of listed on here. But today I'm going to hone in on these first responders. So I will talk about the community as a whole, because first responders and direct victims are within the community that they're residing, but focus on those first responders. And for that reason that I've mentioned a couple of times and that Elizabeth mentioned at the beginning, we don't always think about that. And it's not the first thing that we go to. And it very much does differ as far as the response and the trauma experienced by first responders, but also in the assistance and kind of the follow through after a mass violence incident and what they're experiencing. And people are very impacted. So it's most people on this call, you're here for a webinar because you're somewhat familiar or interested in this impact of mass violence. And we find pretty significant impact across the board. So although about, most victims, so about 60% of people will be resilient. And this is an old article that I quote here, but I haven't updated it because it stayed pretty much the same as these quotes are. But that doesn't mean that other 40%, are not resilient, but it's just saying that about 60% of people will grieve and will suffer following a mass violence incident, and it will eventually decrease. Those symptoms will over time. However, there's a lot of people that still do struggle with pretty significant mental health impact after mass violence incidents. And in our work within our center, what we found is this continues for a long time. So a lot of the community surveys and direct victim surveys that we've done 7, 8, 9 years later, we still find some pretty significant mental health impact. So we see PTSD as a very common symptom, depression, general anxiety, increased fears, anger, a lot of times, decreased perceived safety. And like I said, this mental health impact can go over years. Now, what about when we talk about first responders? So when we talk about the mental health impact among first responders, if we look at rates of all of those different things that I mentioned before, so if we take out the MVI piece, but we just look at rates of PTSD, depression, anxiety among first responders in general, not even first responders who have experienced MVI, we find very heightened rates of all of those mental health symptoms. And a lot of that is just because of the unique facets of their job. So they are, as a first responder, they're being faced with trauma as a part of their job on maybe not a daily basis, but typically on a daily basis and on a pretty frequent basis. And all of the literature basically shows that as you have this cumulative trauma, your risk factors or your risk and your likelihood of developing all of these things significantly increases as the number of traumas go up. So when you think about a first responder, even if you're not familiar with first responder work, just thinking of what they do, there's a significant amount of cumulative trauma. So then if we already have that there, so we already have that mental health concern among first responders, what happens then if a mass violence incident occurs in their communities? And that was one of the actually very first things that we did as a part of our center when we were started in 2017. So in 2018 and 2019, we went and wanted to do focus groups. So we chose 4 sites. At the time, we kind of chose the sites because of their differences, because of our connections with first responders in the area, and just because of their differences in response among these areas. I'm actually very excited, or not excited, but I'm eager at some point soon to go in and do more focus groups because I think that you see that a lot of these focus groups that are on here, there are a lot more recent ones. So I'm interested to see how, with a lot of efforts in planning and efforts in recovery and response, how this may have impacted first responders differently. So what we did is we went into these 4 communities, and I'll talk about these 4 communities in just a second, and invited first responders who were directly involved in the event. So we worked very closely as part of our center. We partner very closely with police and fire, kind of national organizations. And so we worked directly with them and talked with people in these particular districts or in these particular communities. And I was actually very blown away by when I arrived. They set it up, they did the invitations, they organized who was going to be in the room. And I was completely blown away, like I said, by the number of people, first of all, that were there. So there was between 16 and 24 participants present at each focus group. And the majority of the people in the room were the first responders. So not only first responders by title, but they were the very first people on the scene for all 4 of these incidents. And they were willingly there. They were extremely active and extremely engaged and really wanted to help and wanted to provide feedback and be able to help communities in the future and talk about the great things that they did and the things that they would have changed. So those are some of the things I'm going to share with you today. So of those sites, and for those of you who may have trauma cues, I am going to put a picture of each of these up here, not any too disturbing scenes, but just to give you a little bit of a sense of where we're talking about. So just as a reminder of these 4 events, the Aurora movie theater shooting occurred in Aurora, Colorado. It was on July 20th, 2012, and it was inside a Century 16 movie theater at a midnight screening of The Dark Knight Rises. During that event, 12 people were killed and 70 were injured. And based on response of the first responders, there were multiple different jurisdictions that responded. And for those who do know about mass violence, there have been multiple mass violence incidents in this community. So I will say that although this was kind of we specifically went there for this Aurora movie theater shooting and to talk to the first responders of that event. Many of the people in the room had responded to multiple other mass violence events that had happened in the area more recently. The Boston Marathon bombing occurred on April 15th, 2013, and this was near the finish line of the annual Boston Marathon. There were 2 bombs that were detonated, and they were 14 seconds apart. And at this site, or at this incident, 3 people were killed and hundreds were injured. So I don't know an exact number. It varies kind of based on what source you find, but there were hundreds injured in that incident. The Capitol Gazette, as a reminder, was on June 28th, 2018. And this was a mass shooting at the office of the Capitol newspaper in Washington, D.C., or near Washington, D.C., or Annapolis, Annapolis. 5 people were killed and 2 were injured in this incident. And then the Washington Navy Yard was on September 16, 2013. And this was a mass shooting at the headquarters of the Naval Sea Systems Command inside of the Washington Navy Yard in Washington, D.C. 12 people were killed in that incident and 3 were injured. Now, when you look across these incidents, you can probably tell a little bit, probably from a first responder perspective, why we chose these different incidents. We really wanted a combination of feedback from people in different types of jurisdictions that were there, and also really that might have been responding from different locations and from different types of backgrounds of first responder services. So you see there was, systems command at the Washington Navy Yard, whereas Boston Marathon, the responders tended to be a lot more of the jurisdictions that were there just monitoring the marathon and who were there during the incident anyways. And then they ended up kind of shifting their role into response for the mass violence incident. So what we wanted to talk about with them is just in general, kind of what is happening. And what was found is actually very interesting of how it came out when we analyze this data and when we tried to kind of capture the responses. So for those familiar or not familiar with qualitative work, the way that focus group qualitative work is conducted is we do overall focus groups. So I sat down and talked with these participants. Each of them were about 2 to 3 hours in length. So typical focus groups are a lot shorter than that. These first responders wanted to talk, so I just let them keep talking. And they were very much enjoying their time kind of processing these events, talking about the events. And I don't know if I mentioned this, they were in each of the different locations. So they weren't combined. It was at each different site. There was a different event. Or it was specific to that particular event and jurisdiction. So, and then at the end, what we did is took all of that information, transcribed it, pulled it all together and tried to organize it. So the way that we organize it, there's much more kind of formal ways I could discuss qualitative analyses, but essentially we came up with themes. So we wanted to come up with themes of what people were saying and how they were responding to these events. And what was so interesting to us is that these themes very much fell across the same themes that we talk about when we talk about mass violence incident victim assistance. So when we talk about victim assistance in general, which many of you will hear about a lot of this at the conference in a couple of weeks, is it tends to fall kind of in 3 different phases. So it tends to fall in planning. So we talk about how to plan for a mass violence incident, both ahead of time, what can we be doing, but then also we tend to talk, once an event occurs or if an event occurred, of pros and cons of what we could have done differently or things that we did well in planning that helped with that victim assistance after the fact. We talk about response being that 1 to 4 weeks. Now, as you'll see with the first responders, their response tended to be much more on the scene and in that first week as far as what they were talking about. Whereas when we talk about general victim assistance, it is much more kind of in that first month, but you'll see some of their responses that go specifically to that. And then this recovery and resiliency phase, which very much goes from 2 months, maybe 1 month after up until forever. I mean, I feel like we're still in our recovery and resiliency phase, for Mother Emanuel, which happened in 2015. I think people that were present at 9/11 would probably still say they were, or the community still say they're in that recovery and resilience phase. So there isn't really a definition of when that ends over time. So what I wanted to do for this presentation is talk about how we typically talk about these responses in terms of community, and then how first responders kind of mapped onto each of these and what they were saying. So within communities, what we typically talk about is planning is very different from prevention. So planning doesn't mean prevention. What it means is, how can we prepare a community? So how can we plan ahead for any community across the United States that if something were to happen, we are prepared for that? So obviously we don't know kind of where a mass violence incident will occur. So in my opinion, this planning should be happening everywhere. And what we find are the most effective pieces of planning are partnerships. I would say number 1. If you take nothing from this presentation, I think that's the number 1 thing to take. And you'll see that that's exactly what first responders said as well, is developing these partnerships, having a planning committee, which you'll see how that translates to some of the first responder responses, identifying roles and responsibilities of community members. So who's going to do what when this happens? It's going to be chaos. So those who were present for Buffalo kind of in this area can speak to that. There is a lot of people that want to help, and they want to help right now. And that's a good thing. But if you don't have those roles and responsibilities identified and laid out ahead of time, it can lead to a lot of problems. And then identifying those existing resources, knowing what's in your community, knowing where those gaps are, and then developing some formality to that. So some MOUs or some MAOs in communities. So what did first responders say? So when they talked about planning, this was, I would say, probably maybe not 2/3, probably about a half of what was talked about, which that was surprising to me. I expected to go in and hear first responders talk about the day of, what they did, how they, reacted, the things they did well, the things they did poorly. And that's kind of like what first responders are used to doing, right? So they're very, very used to on any scene. They go back, they debrief, they talk about it, they do an analysis of it, reports come out to talk about kind of every step of the actual incident that occurred, but not necessarily the mental health impact of what occurred. So that's what I expected to hear. I was very surprised to hear that much of what they talked about was pros or cons of planning. So things that they did really well and they were proud of, and things that they liked about their planning, and being able to very honestly say, like, we had this already, and that's why we were able to get through this. And that was very beneficial for our departments and also for our community. And then talked about very closely or very well things that they wish that they would have had. So they were very honest about areas that they thought they could have planned better, or things that they could have done better in order to be more prepared. And if this were to happen again, hopefully it doesn't, but if it were to happen again, what are they doing now in order to plan for the future? And this planning for first responders fell into 4, so it fell a little bit differently than when we talk about communities, communities. It definitely maps onto one another. But from first responders, it really fell into these 4 areas. So they talked very closely, and I'm going to go into the first 2 in a little bit more detail because that was the majority of comments on these interagency relations. So good, bad, and ugly about the interagency relations, and on trainings that they had done or that they wish that they had done ahead of time. Since I'm going into those 2 in more detail, I'll talk quickly about budget and policies and experience. So it was pretty much across the board that in all 4 communities, people talked about in the planning phases, budget and policies. So what they were able to spend and kind of what was initially put in their budgets and put in their policies as far as planning very much impacted how they were able to respond the day of. So there was a very high recommendation and stress to prioritize this and have this be a part of the budget in communities, even when mass violence has not occurred. And then experience with mass violence, which that's kind of a given, but I did like that they really talked about it, that the people, so in Aurora specifically, where they had been through several different mass violence incidents in their overall community, they said that they had more experience, and that after the first one, when they didn't have as positive of interagency relationships and hadn't done as many trainings, now they are doing those, and just having that experience has significantly helped. So in talking about interagency relations, I'll walk through each one of these, but I want to just put these up here so people can kind of read through them on their own. But the big pieces that came up with interagency relations is culture, coordination, trust, and relationships. So just kind of to step back and talk about on a broad sense, what people were saying is kind of the biggest take-home message about relations is if I already had a relationship with people in other jurisdictions. So if I'm a police officer and I already trust and have a relationship with the fire service or with EMS, if it's not connected with the fire service or with another agency, with the safety teams, with the schools, with all of these other different agencies, then I was better off the day of the event, I think is probably just if you had to say an elevator sentence of what the take-home message was. And there is a very different culture across different first responder agencies. And there's, of course, banter, just like with different areas of the military or different areas of first responders, but they were very willing to kind of in these focus groups talk about that banter and talk about the importance of, even though as a firefighter, I may, diss a police officer or talk about, how their work is easier or better or different or whatever than mine is, it was so important to trust the other agencies and to already know them. So I think a couple comments that they said is this, some improvements that they talk about was we need to figure out better ways to include each other. So they're in their own silos. They do their daily jobs. So he said, we get into our own silos and we do things our own way and don't tell the other people why we do it. We need to learn how to communicate better. And this really came into play and came into conversation when they were talking about not only understanding your job, but why you're doing your job and why you're making certain decisions. I think one of the things that is even more basic than the training together is the contact time together, they said. So, because when you roll in, you've got facial recognition with even a third of the people working with, your confidence is high. And there were a lot of very similar statements of people really talking about if I trusted this person and I already knew them and they called me and they said, do this, or they ordered me and said to do this, I was much more likely to do it just because I knew them and I trusted them. Whether that's right or wrong, that's how they felt. Another comment, it may sound a little goofy, but it's all about your relationships from the ground up, from the beat officers and the firefighters in the station to the fire and police commanders, the relationship. You have to have those relationships ahead of time. And then it did go even beyond the first responder relations. So this last comment was about, and this is what we talk about in communities. So I was pleased to hear that first responders were kind of mirroring this same piece of the same kind of consensus that's talked about when we talk about communities, is those non-traditional partnerships that we don't always think about. So this was a police officer that said, from police and fire at the command level, the churches, the community groups, the mall security relationship. He said, hey, can we use your vacant storefront? Yes. To the Sam's Club down the street. Hey, we need to give water to 500 police officers. And they're like, here's a pallet. So we talk about that within communities, but first responders were very much saying that, of having relationships and being able to set those up ahead of time, knowing that you will need water. You'll need water for police officers, and you'll need water for communities. You'll need water for the victims, for the families, for everyone. So having that built ahead of time. So that's for the relationships. Moving to the trainings, they talk, I know, within first responders, both, first responders that we're thinking about here, also military, also, any kind of coordinated response like this. Trainings are a big piece of what they do. You have to do all of these trainings, but it was stressed very, very significantly, the importance of having multidisciplinary and coordinated trainings at all levels. So having everyone at the table have practice. So not only here's what our plan is, let us see your plan and what's your plan, but actually having simulations and trainings where you're practicing doing this together. And a big piece that came out was, you don't know on the day of when an incident occurs who the incident command is going to be, because it really depends on where it happens, what type of setting you're in, who's first on the scene, how many jurisdictions are involved. So you really need to be doing not just one training, but a range of trainings where you practice multiple different scenarios and really get comfortable with either taking the lead or following the lead, and by any of these people, and really get out of those silos when you're doing that. So a couple comments specifically that were said that I think encompasses a lot of this conversation was, one person said, there's a lot of angst originally from the fire service. I'm not going in there. I'm not putting this stuff on and getting shot at. If I wanted to do that, I'd be a cop. Once we trained the entire departments together, that training took care of a lot of the angst. And that was, a lot of the fire service talked about this, that kind of their role as a first responder, that the police in a typical situation are the ones that go in. And in a mass violence incident, that's still the case. But there is a lot of times fear and kind of just this different, especially depending on what kind of fire department you're in, of this is a very different role to be in. And really having those trainings and working together can decrease a lot of that anxiety and that angst that this firefighter is talking about. Another thing that came up that's not captured in these quotes, but just to mention, is kind of the difference in perspective of first responders. I heard a lot in these focus groups about how the police go in and the fire, most times in a mass violence incident, stays out because they're waiting on, and EMS stays out because they're waiting on people to come out. And that's what happens typically in a scene where there is an active shooter. But in a mass violence incident, there's not a lot of people coming out, unfortunately. So that can cause very significant feelings and significant trauma to the fire service, because in a lot of scenes, people are coming out and they're immediately jumping into task and being able to do their job. But because of the death that's occurring, but also because of the lockdown itself, a lot of people are not coming out in a mass violence incident. So that's leaving the fire service outside and EMS outside, kind of waiting for something that's not occurring. And that waiting time, they talked about being very anxiety provoking. And then one other thing about the trainings that was mentioned, or one other kind of comment, was, now what we're trying to emphasize is it's not just the way we're structured, but the way we train and exercise when we talk about best practices. Quit doing best or big exercises where you have first responders coming and running around and shooting at the bad. We've got that down. We've done that for 20 years. We got to do the next part, where the sergeants, the corporals, the lieutenants, commanders, what decisions are you making to immediately make the transition so that you can save lives? So that's getting to the point of all the first responders know how to do their job, but in a mass violence incident, there's a lot of additional decisions that have to be made outside of that. So make sure that you're training on what those decisions are. And then key stakeholders in the planning. So these are just some of them. I asked them to kind of list and think of. So these are coming directly from them, but they also map directly onto our list that we talk about when we talk about communities, and when we talk about, they didn't say victim NGOs specifically, that's from our list, but that's who they were talking about. So organizations that you're partnering with that are working with victims. So all of these different stakeholders have to be important in the planning. And I really liked that first responders were saying the same thing. So we're saying that from our center for communities, but first responders were mirroring that. So moving on from planning a little bit, and if anyone has questions, you can stick them in the chat, or you can wait until the end because there may be some questions about the planning piece specifically. Response was talked about a lot as well. So what happened on the day of, and and like I said prior, we typically think about response kind of in the first month. They've very much talked about response in terms of the day of, and what did they think they did well, and what do they think that they could have improved on. And in looking back and in processing, what did they feel like processing and talking about and giving advice. I mean, they very much went into these focus groups with the idea of, we're giving advice to other people. I see I have a hand raised. Okay, maybe not, maybe that was an accident. So within response, well, from a community level, what we talk about from our center is we tend to talk about rapid, broad, immediate help. So what are we doing in the moment, at the time, and what is needed immediately? And a lot of that is more triaging needs. So from a community perspective, we talk about triaging the need to ensure physical safety, for medical care, for physical needs. So housing, food, clothing, transportation, problem solving. So there's a lot of kind of figuring out what needs to be done right now. Communication with loved ones is a very big initial piece. So how do we communicate, and how do we get in touch with loved ones and get them to know about where family assistance centers are and where they can go for help? And then emotional support and psychoeducation. And we'll talk about the resiliency stage in a minute, about how that later is where kind of the mental health treatment and assessing for mental health needs comes in. Right now is triaging what's needed now, and providing information. So that can be done through the media, that could be done through traditional and social media, and providing self-help resources. And there's a variety, I'll actually put a few up here at the very end so that you guys are familiar with them, of self-help resources, including one that we have called Transcend, that are what can be given to people immediately for self-help, and then psychological first aid, which I'll talk about in just a second. So how does this apply to first responders? So when we think about in the moment at the scene, and like I said, this was opened up like this, what do you do when this is part of your job? So it was really interesting to see in these focus groups, to hear the first responders really open up and talk about how they reacted and how these mass violence incidents impacted them, outside of just being part of their job. So I wasn't sure they were going to respond. I mean, I'd talked to people here kind of after a manual AME, and knew, a little bit just from my own work and working with first responders, but it was interesting to hear across the board how most of them talked about it being very different from all other calls. So it very much was, a different experience. And a big piece of that, one piece was personally, and it being, personally, a big event and a pretty significant trauma, but also having their families and their communities be such a part of it. So family members, especially extended family members, don't always know what a first responder is doing on a day-to-day basis. They don't know all of the calls unless they're listening to the scanner. They don't know all of the calls that the first responder is going on. They don't know how much danger they're in even when they go to that call. However, what they do know is when a mass violence incident happens and it's immediately on the news, or they immediately can search it on social media or on any news headline that their loved one is in danger, and they know play by play what's happening. And a lot of the first responders talked about that being a pretty significant difference, that all of a sudden their job that they're used to do, or not used to doing, but that they're doing, and they're going into job mode and trying to fix the scene, or trying to do, for police officers, get the perpetrator, to get people to safety, for everyone to assess needs, to provide medical care. And then all of a sudden their play-by-play on their job is being watched by their families, by their extended families, and by their entire community. And that is a very different feeling for them. And they're starting to get calls. So how do they manage that? And how do they kind of handle that within the context of their work? And then after, so in that, we'll talk about resiliency in a bit, but in those first few weeks, there aren't always very available or accessible resources that are specific to first responders. So we've talked about that a lot within our center over the past year or so, about how it's not that first responders can't access the same resources. I mean, they are victims, they can, but they're just not as likely to, if they're not catered to their specific role, and if the culture of their role isn't included within them, and if it's not specifically outlined for first responders, they're not as likely. So they're not very likely to walk into a virtual or into a resiliency center and seek help, because they see themselves intrinsically different, because they were doing their job on that day. So that's where kind of that response can be very different, not only from on the scene, it's obviously different, but how they react in that first month. So when they gave feedback, it very much fell in the three kind of distinct categories. So the first category, which this I kind of expected, was they talked about on the scene, kind of that scene safety and that containing threats. So like doing their job. So how did I make sure the scene was safe, and how did I make sure that others were not threatened in the incident? The next kind of area they talked about is more of that, what did they do with one another, which very much plays directly into, or is directly coming off of that foundation of that first phase of planning. So how well did they collaborate? How well did they work together? And how well was information shared and communication? How well did it occur, or how poorly did it occur kind of on the day in the scene? And then they did talk about a focus on victim needs, which I think I'm going to highlight several of those comments in a bit, because I think for a lot of victim assistance people, there are a lot of victim assistance people on this call. And I know that I was very interested to hear how much more emphasis is placed on victim needs, and how much first responders very much were aware of that, and maybe not completely doing it because they have a role to do in that position, but it was discussed a lot more than I expected in these groups, which I think was great. So when we talk about scene safety and containing threat, they talked about kind of how they could have improved on it, and the things that they thought they did well. So one man said, we're really, really good at stopping the incident and doing it in one of three ways. You either kill them, you barricade them, or you push them out of the situation and you get them later. That's one of the three things that every law enforcement officer now will do. And we're getting really good at stopping that within 3 or 4 minutes. We're really good at that. And then he went on to, and that was the emphasis of talking about, like, this piece we've got the safety piece and the containing threat piece. It's all of the other components of the incident that we don't necessarily have. So then he went on to say, let's take a time out. All we are concerned about is that the bad guys are in custody or down or dead or barricaded or whatever. So he was saying, what else is there? And then that's when it very quickly, I think, in all 4 of these focus groups, transitioned into, but what else is there? And that's where they went very much into this collaboration and victim needs outside of just this scene safety that they're trained over and over and over to do. So in terms of collaboration, one police officer said, I saw the command vehicles come in. Police went this way, fire command went this way, city command went to a different parking lot and you kind of went, hey guys, we can work together. And this was a comment talking about that they did not have that collaboration that they wanted. So they now have done a lot more planning and trying to build that collaboration, because this is an example of if that planning and that collaboration and that training, in their opinion, would have been there kind of prior to the incident, they felt like they would have been able to work together a lot more closely. So this really speaks of just in this one quote to those silos and to them recognizing the difficulty and the problem with those silos and how it's so important for that command to come together and really be working together in that incident. And that's the case in most mass violence incidents. If it's in a small area or in a rural area, there aren't multiple jurisdictions typically that will respond. But in most mass violence incidents, multiple different jurisdictions are responding to that. And then information sharing and communication. So the first quote on here is talking about that they did not think it was done well, and they thought there could be some improvements. So the way it was dispatched, basically just a shooting. Looking back on it, we all know it wasn't just a shooting, and the information that came in wasn't correct, and how it was relayed wasn't correct. It would have been different if we knew. The psychological piece is a big part of it. So they were reflecting on showing up at a scene and not quite understanding the complexity of the scene that they were arriving on, and that they thought the information sharing and communication could have been significantly improved on. The next quote was on where they thought information sharing went very well and outside of just the agencies and the jurisdictions, but to those other agencies and other partners. So first call, obviously I am Xing out the direct names, but first call was to Chief 1, then to Chief 2, then notifying all different support agencies to do stuff. They probably did one of the best things they could have done. He went to the local hospital to notify them and act as a liaison. It was just literally the right people. So really speaking to knowing outside of that scene, who can they go to and how can they share information and communication directly to be able to help victims and help first responders as well following the incident and in the hours and days and weeks that can come from that. And then, like I said, there was a focus on victim needs. So there are a couple trauma cues in these, just to warn people in a couple of these quotes. And that was the conversation around this very much fell on trainings that they had recently done and ways that they had debriefed and talked about practices and how to change practices so that they're thinking of victim needs while also doing their job to secure the scene and to make sure that the perpetrator is found and that people are safe, which is that's their comfort level. They feel comfortable with getting people to safety. That's part of their role, but also thinking about those victim needs. So we have a whole day now to evacuate kids. We do not need to tramp 8-year-olds through a bloody crime scene. And he went on to talk more graphically, but I didn't want to include it on this slide. But really talking about, and what he's referring to here is the perpetrator had been caught and had, in this case, I can't remember which scene it was, if they had apprehended the perpetrator or if he had been killed in the scene, but he was really speaking to that we don't need to quickly get everyone out. We need to think about the victim needs and the later psychological impact on these 8-year-olds. So how can we get them out safely, but we don't need to have them see undue things that aren't necessary for them, so that when the goal is safety. Evacuate the building. And I actually love this quote. Evacuate the building. I don't know. How about sending a school administrator in there? Make an announcement in a voice the kids recognize and say, hey, this is the vice principal so-and-so. Everything's fine. Police are going to come around and let everybody out. So they were very much talking about how they can do their job, but really rely on other people to try to help kids feel more safe. And then most of the active shooter events historically are done within, the threat is eliminated within 10 minutes. Everybody thinks that's the end of the event. Well, it isn't. What happens to the people after they are evacuated? So they really did start thinking about those victim needs and what's happening next. And where I take this is, because we're talking about first responders and their needs, that I almost wish, and I hope that we can in the future make this a little bit more available to first responders, that it's not just what happens to the people after they're evacuated, but what happens to the first responders after the people are evacuated and after this event is over, because they also are being impacted and are the victims of these incidents. And then psychological first aid, this was not mentioned as part of the focus groups, but I do want to mention it because it is so important that this is within that recovery phase. It's an evidence-informed approach for assisting in the immediate aftermath of trauma, and it's to foster short and long-term adaptive functioning. So this is a very short treatment. It's delivered in the first 24 to 72 hours. It's available in 4 languages, it may be more now, and in a 6-hour interactive course to learn how to deliver psychological first aid. Many people on this call are probably trained in doing this. But I do think that this is something, it was mentioned a little bit, but that we need to really be thinking about in terms of first responders and how we are delivering some of these immediate interventions to first responders. There also are others that are, but this is one that we very highly recommend kind of to work with right after an incident. And then moving into that recovery and resiliency phase. So then what happens after? And like I said before, they didn't talk as much as I would have liked to have heard about what happens after. And I think a lot of that is because what's getting kind of lost and what's kind of their recovery and kind of what's happening after the fact as far as treatment and as far as moving forward. And when it was brought up that a lot of the first responders that were there had engaged in treatment, which is very positive and was very good. And they had found benefits from the treatment, but really it was just on that mental health treatment kind of component. So during this phase, the goal is just overall in general is to resume everyday activities, to resolve issues related to the events, to facilitate effective grieving, to recalibrate to a new normal. So for the whole community, this is a new normal. It's not going to function how it typically has functioned. And everything isn't going to change, but there will be a new normal. And then seek a future orientation. So being able to be hopeful and kind of see what's next is a big goal of this phase. And really to assess and triage needs for ongoing mental health and other support services. The first responders talked about this, and we talk about this within our center, that we really need to figure out and be paying more attention to and delivering more intentionally these mental health and support services for first responders. So like I said before, they're not likely to walk into a resiliency center, and the ongoing services that we typically provide following a mass violence incident for communities are listed here. That we provide resiliency centers, case management and community coordination, coordinated evidence-based support and treatment services, and then support around memorial services. And if we just look at any of these, we're not necessarily delivering them. And some communities are probably doing it very well. So I'm not saying nobody is, but delivering them and thinking about how we reach and provide access to first responders in these ongoing services and activities. And some of them talked about that. So first responder families. So really thinking through how do we focus on what was mentioned before? So one of the main comments that they talked about in recovery and resilience was that impact on their family. And I'll show you a couple of quotes that really highlights this pretty strongly in a minute. But that was a big concern of all of the first responders we talked about, is that my family is now more included than they usually are with my work. They're now a part of this, and I don't always choose to have them be a part of this, but the incident itself has made them a part of this. And then what's that long-term impact? How do commemorations play into that? That impacts an entire community, and it definitely impacts first responders as well. And then there's a lot of just things that happen around mass violence incidents. So there's conspiracies. They talked about these, and these were this was the feedback specifically from first responders. Political concerns, court and trials, just things that add additional. So those bottom three are things that add additional stress and add additional difficulty to that recovery and resilience following an incident. So what a couple of the families said is, one of the firefighters said, it affected my wife. It affected my family a lot. It almost killed my wife. And he didn't mean actually killed his wife, but just emotionally, it was too much. And this lieutenant actually talked about how he typically sheltered his wife. So she wasn't a spouse that typically listened to the scanner. He didn't talk a lot about work and didn't talk a lot about the incidents that he was going into. And now he was being forced to kind of change his practice and how he did that. Now, whether his practice was good or bad is kind of beyond the point here. It's more that because it was a mass violence incident, his wife was very immediately brought into it. Another quote was, one of the ideas was that we could get all the families together off duty so that people's wives, husbands, girlfriends could get together and commiserate about what their significant other does and how they manage the stress. That was a tool that was open to us. And that was in one of the communities. And that was a positive recommendation that they talked about, that was very, very helpful, is that they didn't typically do that after an incident. And now after this shooting occurred, they did very much build a support group for their family members to get together. And I really liked that it was family members across the different agencies. So they really could kind of hear the different perspectives and just be a form of support for one another. Both connected to the first responder support, but also in addition to. And I can say from just working with first responders in a broad trauma context, that tends to be the first thing that they're going to, and the first thing that they're thinking about is the stress and health of their families. So being able to cater to that and address that is very much also impacting first responder mental health. Now, we also need to focus directly on first responder mental health, but focusing on the families is helping some of that stress as well. The long-term impact, one of the participants said, we will always go back to that building knowing that we did what we did at that certain spot at that certain time. And you walk through the front vestibule area, and knowing what happened to the right is something we will always just have to deal with and live with. I don't ever want to transfer from that station just because of that. That's not going to push me away from that area. I love the area, love the station, and I love the people that I work with. So this is, I think, just really speaking to the same trauma cues that that community members and direct victims can often feel and can often go to. But I think this kind of places first responders in that context of, it's not just their job. He was afraid to go back to that building. It bothered him to go in that area. So he is very much seeing it as a victim sees it, not as a worker sees it. So, but he also has pride in that and wants to stay at that station, really wants to continue, and is not going to let that fear keep him away and keep him from doing his job and maintaining kind of his relationship and his role at that station. But that doesn't mean it doesn't have impact. So really thinking about that kind of, I don't want to say humanizes, because obviously first responders are also human, but places them in the context of the similarities to other types of victims that we talk about. And then it won't go away, especially for these guys. Every day they come in, they read the newspaper. Just 2 days ago, the newspaper reached out and wanted to talk to the responders to find out where they were now. And like we've been shutting them down. It does not go away. So this happens again, another quote that really shows that some of the same things that are happening to the victims is happening to first responders as well, as far as media. And I mean, it's well-intentioned. I think that this newspaper journalist was wanting to just get a story, and there wasn't bad intention to it, but it still does tend to impact them on the long term, just like it does all victims. So those were all the focus group stuff I'm going to talk about today. I am going to go into a few resources so that it's helps to provide for people so that they hopefully will be helpful in working with first responders, but also in working just in general with victims and when working on victim assistance. In the short term, PFA and SPR are very good, are evidence-based mental health interventions. And then in the long term, so more talking about PFA is during that middle phase. So it can be delivered during that recovery phase. And then all of the others listed here are more in that resilience and recovery, or that, later phase, that resilience phase that you would want to deliver these. And one important thing just before we wrap is that communities and first responders vary and need different services. So I talked about these as far as kind of overall what are all four of these communities experiencing. And I think if I went to, hopefully we will go to, 10 other communities and conduct focus groups with first responders, and we will hear very similar probably things and add on to the foundation that we've already found from these first responders. But although there are similarities, it's very important to keep in mind that people do also need different services. So just like all victims and all communities don't need the same thing, all first responders don't need the same thing. So it's very important to be educated and know about what's needed kind of more generally, but then also really assess the needs of that particular department or of that particular first responder. So just a few helpful resources before we wrap up today. I already put our website up here, but I'll put it up here again if anyone wants to screenshot it and save it. We also, one of our documents, we work with the Police Executive Research Forum, is our PERF for short, is one of our partners or one of our collaborators that we've worked with over the years through the Mass Violence Center. And they developed this very, very good guide. And you can find, it was in September of 2020 that this was published, and you can find it online. You can find it on our website. And it is more police specific. We are planning to do hopefully one for firefighters as well, and for other areas, potentially EMS and the differences. But this is a really, really good, quality document if anyone's interested. So it's the role of police executives in assisting victims of mass violence, lessons from the field. So they did additional focus groups and interviews and really pulled all of that information together. Another that we developed in collaboration with the National Fallen Firefighter Foundation is this rapid response resource, and it's recommendations following a mass violence incident. And this is just a brief one-pager. So we probably could and should develop an entire kind of manual on this. But this can be found on our website, and it also can be found on the National Fallen Firefighter Foundation website, and talks about just kind of some bullet points about what can be done from in the fire service. What can the chief be doing right immediately following an incident? And it goes through those same stages of pre-planning, and then immediate, and then kind of longer term. And then our virtual resiliency center, which those familiar with our center, with our Mass Violence Center, and who have been working closely with us are aware of this. But we are currently developing a virtual resiliency center. It is launching very soon. And the idea of this is to provide online centralized resources to help professionals and communities create and strengthen individual resilience and collective resiliency after a mass violence event. So resiliency centers, kind of brick and mortar resiliency centers, are often or sometimes located within communities where a mass violence incident has occurred, and that can be funded by AEAP grants through OVC. But a lot of people won't ever walk into a resiliency center for multiple reasons, because of stigma, because of mental health concern, but also because of logistic reasons. A lot of times, take Las Vegas, for example, the majority of people that were present at the festival shooting in Las Vegas did not live in Las Vegas. So they will not be able to walk into a brick and mortar center. So this virtual resiliency center that we're launching is with an effort to be able to address a lot of those barriers and be able to reach people online so that they can receive resources following an incident. And then also, lastly, the Office for Victims of Crime, Mass Violence, and Terrorism Toolkit. So this is through OVC. There's the link on the bottom. You can find it on the OVC website, and it has a plethora of different resources directly related to helping victims of mass violence and terrorism. So it has a lot of the same resources. It's very overlapping as on our website because of our collaborative partnership and cooperative agreement. This is a very good kind of toolkit and place to go to get some more information. So I'm going to leave it here and open up for questions. I didn't see any in the chat, but if you would like, I'm open to people putting questions in the chat, or if you feel comfortable saying out loud and answering questions. So I'll stay on for about the next 15 minutes. So if anyone has questions and would like to ask them, please do. And you're also welcome to reach out to me as well. I did not put my email on here, but it's just my last name, Moreland @musc.edu. And you can find me on the website as well, but please reach out for any resources or any questions that you have. And then lastly, because people might be leaving, thank you for taking the time today. And thank you to OVS and to Elizabeth and to the whole team for having me here today. So it's a big honor.
That was amazing. Thank you. Thank you. Thank you so much. We are so grateful on behalf of everybody. And I see Elizabeth is still here, so I'm going to speak for you, Elizabeth, but I'll pass it over to you. We are so grateful. I'm going to allow some questions to populate, but please note in the chat, we have sent through Angela's email address. We've also shared the slides once again for today's presentation, and I did share that link to the evaluation survey. It really only takes about 2 to 3 minutes. It's very helpful. The feedback we get directly impacts the types and availability of different programming that we provide. So it is super, super helpful. I'm going to take a look at the chat. Angie, I know you're looking at it as well.
Yes, I am. So Devon asked, are special procedures in place for tribal and military communities affected by MVI? That's a really good question. So we do work with tribal communities. So we work with Unified Solutions, who is a kind of overall agency that works with multiple tribal communities. There is a very good webinar that talks about a lot of those. If you just Google it, I'm sure you probably can find it, but talking specifically about tribal communities, I'm not familiar with everything that that is located there, but going through Unified Solutions and through our partnership, I think you probably will be able to find some good resources. Military is a little bit separate. So military communities, I think it is very, very important. And as far as the military is concerned, I think that they have some resources, but that is one area that I think we need to tap into and need to grow. I'm actually a military spouse, so I would say it because I care about it very greatly, but also because I think it's very, very important that that within military communities, they have a lot of these resources as well.
And the NOVA, the National Organization of Victim Assistance, does a lot of training with military units across the country.
Thank you, Elizabeth. And their website, you can probably find that information on there as well if you just Google NOVA.
The other thing, Angie, that was so terrific and really addressing a community that has been so traditionally underserved. And having been a prosecutor for many years, I know that we did not deal with our own trauma at all. But you know what we've recognized in seeing these events is that it extends so far to people that we don't even consider. Like, we've been doing a lot of thinking about funeral directors, you know, in a small community, the funeral director knows everybody. And so, you know, they're now having to perform funerals for people that they know very well. And so the extent of the trauma it can be really far reaching in any community.
I'm glad you mentioned that. That's so true. And we think of a lot, 911 dispatchers, the funeral directors, that, it's multiple, it touches so many people in a community.
See, you did such a good job covering everything that people don't have questions.
Thank you.
We'll also post this recording as well as any materials that were shared to VAP Connect. That's vapconnect.com. I will put that in the chat as well. but this is an online forum for our funded advocates and allied professionals that it sort of works like Reddit. You can actually share your own resources if you find anything. We encourage you to, once we post there, add your own resources as well and keep that conversation going. We'll follow up with an email where we'll link to where that is exactly. So that's a great location to be able to continue this conversation, because what I know is going to happen is people are going to sign off and go, oh, I wanted to talk about this. So we will give you a place to do that. And we
Can you
encourage
tell
you to
that
do that.
Rachel used to be in marketing? Like, always good with the sales pitch.
I mean, but no, we are so grateful. We'll stay on for a couple more minutes, but if that's it, Angie, thank you so much. Everybody who joined, thank you. We encourage you to join our next and final webinar next week, same time. I think they used to say with Batman, same bat time, same bat channel or something.
And thank you to the translators that did an
Absolutely.
excellent job.
Absolutely. So we hope to see you next week. And for those of you coming to the conference, we look forward to welcoming you to Albany.
Thanks so much, Angie. It was so good to see you.
Have a wonderful rest of the week and afternoon.
Thanks. Bye, everybody.
Wonderful. All right, team, it is okay to stop translating. We will end the webinar now. Thank you so much.
Guys, have a good day.